6 COVID-19 dashboard issued by the Ministry of Health outlines that 402 persons are being allowed to isolate themselves in the comfort of their own homes. This figure accounts for more than 90% of the active cases locally. According to Deputy Chief Medical Officer Dr. Karen Gordon-Boyle, who spoke with this newscast via phone on Monday, the hundreds of patients on home isolation, though positive for COVID-19, have only exhibited mild or no symptoms at all, which, according to her, means that they do not require hospital care. Dr. Gordon-Boyle further stated that before approval is given for the patients to home isolate, an assessment is done to ensure that their residences are suitable to facilitate home isolation. The majority of these assessments are conducted via phone, minus any physical inspection of the home by health officials.
All they actually require is to be isolated from John Public. And if they're living under conditions where they can isolate themselves from other people, then we're allowing them to do that. So once they're living in a situation where they may be having their own bedroom, can have their own wares, wash and sanitize after they use the bathrooms. Once they can confidently do that, and we have a checklist that the persons on the surveillance unit would use.
The ministry has in the past reported difficulties with monitoring persons on home isolation, were later found to be defined a stay-at-home order, and as a result putting the public at risk. There have also been reports of persons provided inaccurate contact information to medical personnel who could not trace them. Minister of Public Health Dr. Frank Anthony, during a recent press conference, was asked about the effectiveness of the monitoring mechanism currently in place to ensure compliance by the patients on home isolation. The minister responded by saying that the ministry has established a telephone bank to track persons.
So we have 6 doctors that have been assigned to follow up with patients. They have a checklist, they go through that. Every morning, they call up people and they follow them, right? So that's how we are able to track. And the person, when they were first diagnosed positive, were told that if they encounter any signs or symptoms, we explain what are these signs and symptoms to look for, that they have an emergency number that they can call if they're experiencing any problem.
Dr. Anthony also highlighted that in an effort to strengthen the ministry's monitoring capability, a location tracking app will be considered. A number of quarantine facilities were identified during the early stages of the country's fight against COVID-19 by the former AP and UAFC administration, 4 of which are currently being used to house symptomatic patients, while the majority of positive cases remain at home. As of September 6, of the 468 active cases, 52 persons were in institutional isolation, 14 in the COVID-19 ICU, while a whopping 402 positive persons for COVID-19 were at home. In April, a number of beds in military field gurneys were set up at the Cliff Anderson Sports Hall, having been selected as one of the facilities to quarantine and treat COVID-19 patients. The facility is currently not in use for that purpose, whilst 350 beds remain unused. Dr. Gordon-Boyle expressed that the move to keep symptom-free patients at home reduces the burden on the healthcare system.
It's better for them, and I find most people are more comfortable in their own home than our institution. So it's better for them, in the comfort of their own home. It's less burden on the public health system and the government because it costs money to feed persons 3 times a day and put them with accommodation.
Asymptomatic patients who test positive for COVID-19 can still transmit the virus to others. Temika Rodney reporting for the HGP Nightly News.